Welcome to Data Science Perspectives. This series focuses on analytics and data science professionals from across industry to learn about how their career unfolded, what skills they look for when hiring, and what trends they think are coming next. I'm your host, Bill Franks. Let's get to it. Welcome to this episode of Data Science Perspectives. I'm your host, Bill Franks. Today, I'm going to be joined by Nathan Ghadirifard. I was introduced to Nathan a few years ago by his then boss, and then I quickly found out that he'd actually worked with several friends of mine in Ohio before he moved to Atlanta. It's also been a pleasure to have him serving as one of our advisory board members at KSU School of Data Science and Analytics. Nathan's currently director in the Chief Data and Analytics Office of WellStar Health System. If you're not from Atlanta and not familiar with it, WellStar is perhaps the biggest system in the state of Georgia with a lot of large hospitals and even more medical facilities throughout the region. Prior to coming to WellStar, Nathan spent close to 10 years with the world-famous Cleveland Clinic on the enterprise analytics team up in Ohio. And he began his career prior to that as a healthcare analytics consultant. In addition to these other roles, he's also on the Technology Association of Georgia's Data Governance Society Board. He's got a bachelor's in electrical and electronics engineering from Middle East Technical University, a leading university in Turkey. He's also got an MBA with a focus on information technology from Goldie Beacom College and a data science degree from Miami University. And with that, let's welcome Nathan to the show. Welcome, Nathan. Thanks for joining me for the show.
Oh, thank you very much for having me on your podcast.
Well, it's great to have you. And I think I'll start with you what I like to start with everybody, which is just to kick things off. Tell us a little bit about what initially drew you personally into the world of data and analytics.
From my undergrad studies, I was fascinated by how data can uncover insights and drive decisions. I worked on a project analyzing large data sets to find trends and patterns, which showed me how data science could lead to actionable strategies. For example, predicting patient outcomes on historical data showed the real impact data science can have. This early experience reinforced my passion and directed me towards a career in healthcare analytics.
Yeah, speaking about that, I know prior to coming down here to Atlanta, you worked at the quite famous Cleveland Clinic up in Ohio. What was it that drew you over, given all the different kinds of analytics that you could have done, to the healthcare space, and not only just with your initial consulting and then Cleveland Clinic, but now also with WellStar?
Okay, thank you for this question. Growing up with my parents in healthcare gave me a deep understanding of the system from my early ages. Combining this background with my passion for data made healthcare a natural fit for me. At Cleveland Clinic, I was able to use my knowledge to improve patient care through analytics. I worked on projects that use data to enhance outcome and streamline operations, which perfectly aligned with my interest in healthcare.
So one thing I'd be curious about, especially folks who don't know a lot about healthcare analytics, a lot of people think about healthcare analytics being focused on, identifying or treating disease, let's say a patient-centric. But as you pointed out, you mentioned the operations. Maybe just give an example or two of what would operational analytics be in a healthcare context.
Yes, operational analytics, like, for example, I will give you some example of, for example, AI-driven analytics, like predicting number of readmissions or predicting how many, for example, sepsis patients we are going to have in the future. There's several studies like that, or a length of stay of a patient, how long a patient is going to stay at a hospital, trying to predict from the time that patients comes to the hospital, what is going to happen to the patient, and try to coordinate accordingly.
So you get into, I guess, with all that, you're getting into managing the room inventories, managing like how much staffing you're going to need and so forth. So it ends up
Exactly.
resulting in patient care, but it's really tied to the factors that surround it.
That's correct. That's correct.
And in your mind, is that which is more advanced generically? I'm not asking about necessarily WellStar or Cleveland, but generically, um, is the effort being put on operational analytics increasing or holding steady in the past few years? Because for me, just in talking to people, I feel like it's really picked up the interest in the operational aspects for a large health system as opposed to the, you know, the long focus on the health components.
Definitely. There was an interest before, obviously, but I think recently there is a little bit of more interest on operational aspects. It depends also where the health system is located, in what situation the health systems is. For example, at WellStar, we are working with our strategy team, and we build strategies around some of those operational decisions on how many patients do we want, how many patient increase do we want in certain areas, what are the areas of opportunities, where do we want to add some providers, remove providers, or where we would like to add new offices. These are all type of decisions that we make with the data that's available to us.
And so, speaking of that data, I know there's a lot of robust data in healthcare, but then there's challenges in terms of like, electronic medical records and such have, a lot of legal protections and ethical considerations in using it. So how do you see some of the innovations in data management and AI playing out in healthcare to make the use of that data maybe, easier and safer as well?
Okay. I think in today's healthcare space, the opportunity for analytics and AI is really enormous, but privacy concerns remain a significant challenge. The key to navigating this is, I think, balancing innovation with data governance. Many organizations are building or they have created a really good data governance. At WellStar, we implemented AI-driven models, for example, to predict patient risks, but we ensure that all data processing compliant with strict regulations such as HIPAA. We use technologies like encryption, anonymization, and secure data sharing to protect patient information while harnessing the power of AI to improve care. I think moving forward, I see healthcare organizations increasingly they're adopting frameworks that prioritize but cutting edge innovations and robust privacy protections to ensure that AI achievements benefit patients without compromising their data security.
Yeah, I know that's been a big area. I think the thing that I always find intriguing is that a lot of people will immediately jump to, concerns about individual medical records or your individual records, and not that those aren't founded, but there's so much to be learned in the patterns across those records where you might need to have someone like yourself querying those records to run some kind of analysis, but the output is at an aggregate level and such, so everybody's protected, but you're learning key information across that that base of people with records. So I'm assuming that you probably, when you mentioned the governance and so forth, there's much different rules for how you or your teams are able to access data depending on whether you're actually trying to do something with individuals versus you're aggregating information for a pattern and so forth. That's all baked into the procedures you described, I'm assuming.
That's correct. So we created a data governance group within our data and insights team at WellStar, and creating rules and policies is a portion of that work that data governance group does. But it's not limited to that. We are using data. We create data catalogs, data quality. We make sure that the data has the right quality as well.
So as an industry, obviously the healthcare was smack in the middle of all the COVID crisis, and I know it. I mean, it stressed every aspect, including the data analytics teams. Have
Mm.
there been any changes in terms of either analytics or policies that you kind of had to adopt that have since become kind of standard and stuck, as opposed to just something that was done in the heat of the moment?
Yes, I think the pandemic really showed how essential data and analytics are in healthcare. Before, we mainly used data for looking back at past trends. But during the pandemic, real-time data became crucial for managing patient care and operations, I think. We moved from static reports to dynamic dashboards that track, for example, COVID-19 cases, hospital capacity, and patient outcomes in real time. This shift helped us make quick, informed decisions and adapt to fast changing conditions, providing how crucial data is for handling crisis and improving care.
So I guess that actually ties back to the earlier discussion about how the focus on operational analytics seems to have really picked up. Maybe part of that is because, to your point, the hospitals were forced into some of that because of the capacity and supply chain issues during COVID. But then the value of those data sources and the analytics that were created, I guess, are still flowing today. So that could be one of those things where the pandemic, that was one of the good outcomes of the pandemic, was getting the hospitals beyond that look back snapshot reporting.
That's right. That's a very good point, Bill. And also, as I said, I think it depends also in what type of market the health system is. And as you know, we are currently, WellStar is in Atlanta market, and it's very competitive. So we will need to do a lot more of operational strategies than maybe some other health system that might be rural.
Okay. Well, now that you've been working now for a long enough to have established yourself in your career. So what do you think, if you look back across the roles you've had, what's one or two of the skills or traits that you think has most helped you personally be successful?
Yeah, I think a key skill that helped me succeed is quickly understanding complex problems and find creative solutions. For example, when we had challenges integrating new analytic tools at WellStar, I identified the issues and developed a creative solution that streamlined the process. This is not only resolved the problem efficiently, but also enhanced our analytics capability, showing how important it is to combine problem solving with creative thinking.
So is that something that you intentionally developed or studied, or is it more something that you naturally had and you just found that when you applied it at work, it worked to your advantage, so you did it more?
I think that is something I naturally have, but I think many leaders they naturally have learn through their career how to work with complex problems and create some creative solutions based on that.
I know it's a common theme. I think people who aren't in data and analytics tend to think that it's not a very creative space, but it really is. Maybe if you're purely on the data management side, right, that's more of a systems thing. But when you're actually doing the analytics, there's a lot of creativity that goes into figuring out how to best apply that data, and particularly like in some of the backgrounds you've had, where you're maybe doing things for the first time, certainly for that property or that employer, or if not for the industry. In some cases during COVID, there was a lot of just new stuff happening, and I'm sure you and your team were pushed to your limits in figuring out what you could do.
Yeah, I 100% agree. I 100% agree.
So if you look back, obviously here at KSU, we've got a huge student body that seems to continue to grow, and all of them are thinking about getting their first job. what's one thing that as you look back that you wish someone had told you about in the working world before you landed in a job and learned it the hard way?
Yeah, I think I wish someone had told me how crucial it is to be, I think, diplomatic and adapt at navigating different business situations. Understanding how to manage diverse perspective and handle various dynamics effectively would have made a significant difference in my early career. Helping me, I think it would help me build better relations and achieve more successful outcomes.
So I'm assuming, like me, when you had your technical coursework and all, things like diplomacy may literally have never even been brought up, not just not emphasized, but maybe
Mhm.
never mentioned in an academic context. Is that true for? Because I know you were engineering initially.
Yes, but sort of, right? It depends. It I'm sure there are some in universities. There are some elective courses that students can take to get more familiar with um, strategies or how to communicate with others. But it's less common, yes, in engineering world to get those skills, and um, and I highly recommend anyone who is planning to get into this field to work on those skills because it helps with the great communication and having a better relations with others.
So, since you're in the chief data and analytics office there at WellStar, obviously you're going to be working across the organization. Like, how do you go? What's your process? So, let's say I'm one of your stakeholders and you develop something, and then I'm, you know, either not believing you, I'm upset with the result because it's not what I wanted and such, and you have to bring out that diplomacy. Do you have any? Is there any specific strategy or approach that you tend to use towards it, or do you just try and figure out where that individual person's coming from and kind of customize an approach to dealing with them? Or
And I think it's very important to learn how to work with different perspectives, as I said, and each person has a different perspective of looking at certain problems, and it's very important for a leader, I think, to be able, or anyone working in data and analytics, to be able to understand and be flexible to change approach according to those perspectives.
so when you're looking to expand the team, and let's take two different levels, right? There might be like an entry level person coming in right out of school, and then
Mm-hmm.
maybe let's say somebody who's got 5 or 10 years experience going to come in as one of your your manager, senior manager type level, et cetera. What are some of the specific skills or traits that you're looking for in people today when when they're applying for those positions with you and your team?
Um, I think no matter if they are junior or they are senior, I look for curiosity, I look for problem solving and strong communication skills. If they're a little bit more senior, of course, I would like to them to have technical expertise, and that matters too. But being able to collaborate and think critically about how data applies and in real world situation is just as important and as technical expertise, I think.
So I actually don't know the answer to this one. I know different companies are in different stages. When you speak about collaboration and working together, is is WellStar, are you all primarily doing that in an office environment now where you're collaborating because you're mainly in the office multiple, if not every day of the week, or is it still a largely you're online on Microsoft Teams or similar, or having the virtual discussions?
And we are mainly working remotely, or at least our department or IT in general is working remotely at WellStar Health System. But during the pandemic and after pandemic, we found some really creative ways to engage with our employees and also make sure that we have same level of communication or with them and understand them as before pandemic when we were in the office.
Okay. Yeah, and I guess you know, tying those last couple things together, if you know you were talking to a you know a student today and they're thinking about how they're going to get ready for their upcoming interviews and select their you know maybe their final courses to take, what advice would you give them to in terms of how to come in with their attitude and their mindset when they do start that first job?
Okay, thank you for asking that question. My advice to students starting their career is to be comfortable with being uncomfortable. Embrace changes and embrace challenges and new experiences, as they often lead to growth, learning, and understanding, I think. Stepping out of your comfort zone can open doors to new opportunities and help you develop the skills and resilience needed for a successful career.
Yeah, I think that's good advice because it does seem to me that some of the younger folks today, the pattern has been that they're not necessarily being pushed out of their comfort zone. In fact, it's almost considered taboo to push someone out of their comfort zone.
Mm-hmm.
And if you've gone through what could end up being basically 16 years of school, never being pushed out of a comfort zone, it's going to be a rude shock when you get on the real job and realize, oh, wow, you know what? If I don't do it right, someone's going to actually yell at me, and I actually, you know, might have my, you know, my job threatened. It's not, you know, I'm not just going to be told, well, thanks for trying and we'll try again next month. So I think it's important for people to practice that.
Yes.
Have you found any major trends changing in terms of how candidates or new employees are coming in now versus like during the pandemic, or has it been pretty much the same kind of people coming in and it's just that the work environment's slightly different?
I don't see a major change, be honest, in the candidates that we see in the market right now. One change that I see is that many candidates. I have a feeling that after pandemic, candidates think that they know more than what they actually know, and sometimes you see a lot more on their resumes, and this would be the case before the pandemic too. But I have a feeling that after pandemic, this became more trendy. That one advice that I have to all the students is just write what you know. You know what I mean? Because if you write something that you don't know, the interviewer or the working place, they're going to understand, and it might not be result in a good way.
Yeah, so I think one of the things that's changed is there's a lot of HR application screening algorithm keyword gaming. And to your point, it's, you know, I think people are trying to go for as many keywords as they feel they can even remotely justify putting on that resume. And to your point,
Right.
The problem is, I'll just make something up. I put down Python as a skill, and all I've ever really done is 2 or 3 days of playing around with it. Okay, let's say that actually gets me the interview because that's an important keyword. Once I'm at that interview and they start asking me questions, they're going to realize I don't know a thing about Python. And so not only am I not going to get that job, but it's also possible they could flag in the system something, this person's completely unqualified, so that if I apply for a job later, you know, they'll see that, you know, well, oh gosh, well, Nathan already talked to this person and they didn't know what they're talking about. I'm not going to talk to him now.
Exactly. Yeah.
So what's one example, we'll finish with two things. If you were to think, again, it doesn't have to necessarily be at WellStar, but as we think about AI and how it's hitting all the industries, is there one example of AI being put in place within the healthcare space in, say, the last year or so that you thought was super cool and very exciting?
Yes, we have several AI projects that helps our organization right now to make some really good decisions. Um, uh, I believe one of the hottest areas in analytics and data science will be shifting toward AI-driven automation. I think the traditional role of manually creating dashboard and visualizations also will evolve with AI. AI is becoming more capable of automating many of the processes that we are doing right now. We are already seeing AI tools that they can generate insights and visualizations in real time, allowing analysts to focus more on interpreting results and strategy rather than building just reports.
Excellent. And is there anything that if you were to look out, 3-5 years ahead, is there any specific trend or analysis that you're specifically excited about these days?
Yes, I think over a long time, as I said, the role of analyst is going to change, and you're not going to see typical analysts just building dashboards anymore. With the help of AI, all these will be automated. You're going to just connect maybe your data into the data source, and with minimal effort, you would be able to get the type of insights or from the data that you need. Like for example, and this is happening maybe right now too, but it's just the beginning. Like for example, even ChatGPT, right? It's going to come to a date that you're going to just how we are writing something on ChatGPT and just gives the result to us. Maybe our doctors or our analysts or anybody within healthcare organization, they write something and it's going to just show them the answer the right away. It's just we need to make sure that there are several steps in order to get there, and I think the healthcare organizations are not there yet, but I'm excited and I would like to see how this is going to evolve within the next 5 years.
Yeah, and I'll just call it, I agree with you. I'd also say there are people who get worried about that trend you're pointing out, thinking it's somehow going to take people's jobs in the analytics space. And I think not, only because I don't know a single analytics organization that doesn't have a list of 10 times as many requests as they can get to. And so this automation you're discussing will help those same employees get more done, but they're not going to get so much done that they need less employees. And in fact, I'd argue as you're actually getting more done and there's more value, the request list will just increase again, and you could still end up with more people because You'll have even that much more.
Yes, I agree with you. I think the type of works that or some of the roles that we have right now, they're going to change a little bit, but we will still need those roles, and we will need maybe more of those, as you said, because we are going to have many more requests, and we actually have many requests right now. We're going to have many more as the data becomes more accessible.
Well, I'll tell you what, I know you're busy, and I've taken a lot of your time. I want to thank you for your insights today. I think it'll be really helpful for the audience, and just thanks again so much for taking your time to speak with me on the show.
Okay, thank you very much for having me. It's a great pleasure. Thank you very much.